service, how your role plays a part. As we go along, if you have questions, please feel free to put them in the chat box, and then Devin can just stop me along the way. Or if you want to make a comment on things that you're doing that, you know, are working well or you need some assistance with. And then we'll also have time at the end. So we're really going to talk about making a first great impression. So you guys have as I said earlier, a lot of responsibility. So we're going to talk about that as well. We're also going to just really focus on how to make sure your patient has a really good experience. And we'll talk about what that means. So when you think about your responsibilities, you guys have a lot. You're responsible, many of you, for number one, greeting patients in face-to-face, but also on the telephone, scheduling patients, rescheduling patients. Of course, professionalism and customer service is at the forefront. You also play a part in billing because you do that insurance verification. You put in the patient's insurance, you make sure they're eligible. You should be doing point of service collections. So you play a big part in the billing side. Of course, patient engagement, and then legal and regulatory, right? Because you've got HIPAA, you have your Medicare secondary payers. So you can see that your role is very large and broad. So you have a little piece of every piece of that health center. You are a big part of team-based care. So as we go through these next 3 series, we're going to be talking about these. So for you, I always say we really want to create a connection with your patients, not a transaction. So a transaction is when you go to Walmart and you go through that checker line. That checker is not making a connection with you. They know you're coming back to Walmart. So they're doing a transaction. You're trying to create a connection between you and your patients. Your role is so important. You are probably one of the most important people in your health center. You're the very first and last impression that that patient sees. How you handle any situation makes a huge impact on how that patient perceives your practice. So if they walk in and they have a really good experience at the front desk, the patient's happy, the front desk person's engaging the patient, no matter what happens along the way, that patient is going to remember that. Versus if they walk in and the front desk person's too busy, they're on the phone, they're short with the patient, that's how the patient's going to perceive your health center. So it's going to be really important to think about how we interact with our patients. We know that patients don't feel good, right? So sometimes they're a little bit on the grumpy side. So how can we get them to kind of transform? If you think about from the billing side, a lot of you are like, you know, we've got a billing department. Why am I doing the billing? Well, you are the only member typically that has any contact with that patient regarding their bill. So you're kind of that first step when that patient sees you for the ability to collect. And we'll talk more as we go into the other series on collections. But if you think about it, if I have a $5 copay, how likely is the billing office going to be able to get that from me versus how likely are you to get that from me? So again, your role is so important. You start the flow. If there's disruption at the front desk, there's disruption all the way through. And as we just said, billing starts with you. So if by chance you don't get the insurance information right, we don't get eligibility right, we don't check the copay and collect that, we don't check the previous balance and collect that, we already have a disruption in that billing process. It's kind of like a whole row of dominoes. If you pull one out, they're all going to fall down. Education. Education starts with you, right? What is a business associate agreement? What's a HIPAA agreement. What's a HIPAA agreement? A patient doesn't know what that is. Many of them have no idea what the sliding fee is. So for you guys at the front desk, you have to understand the what and the why of everything you do. If I'm a patient and I ask you why I need to sign that HIPAA agreement, you need to be able to tell me. If I ask you why I need to bring in proof of residency or proof of my job, why? If you don't know why, you have to figure out why, because the patient is relying on you to educate them. So these are some of the basic bullet points, and we're going to talk about all of these. So we're going to talk about patience and acknowledgement, communication, compassion and empathy. We're going to talk about awareness and how to be efficient and detail oriented in your job. We're going to talk about good telephone etiquette and how to be accountable and have good work integrity and teamwork. Now, many of you already know these things, so they're just kind of a refresher and kind of really getting us back to the grassroots. Because what happens is we get in the weeds of things and we start getting busy and we really forget to go back to the basics. So when we think about acknowledgement and patience, it's greetings. So our first impression from our patients, they're looking at how they're treated when they visit your health center. And not just medically how they're treated, right? They expect that your doctor's going to do a good job or your nurse practitioner is going to do a good job. But how are they treated when they walk in that door? Also, their first impression, am I in a waiting room or am I in a reception area? Think about that. Waiting room, take a number, sit down. Reception area, friendly, it's comfortable, it's homey. So first impressions are so important. Building trust. So again, this is why I want you at the front desk to know the what and the why. Being able to communicate with that patient, building trust with them, being honest. How long is the wait? If you don't know, contact that MA. Hey, Shelly's here and she wants to know approximately how long will the wait be for Dr. Jones. Check back in with that patient. So what do I mean by that? You guys have to own that reception area. You have to own it all day long. So when you see that patient sitting out there and they've been out there for 15 or 20 minutes, just because you have a sign that says, hello, if you haven't been waited on in the 15 minutes or you've been waiting longer than 20, come and see me. No, let's be proactive. Hey, I see Shelly sitting out there. I'm going to go out and ask her who she's waiting on, and I'm going to check with that provider and see how they're doing. So you own that waiting room, because what happens if that patient walks in and forgot to check in? Maybe there was a long line, they sat down, started reading. So maybe nobody's even checked them in yet. Communication. So you guys have to be able to communicate clear and concise, short and sweet. You have to be effective with your communication, and you have to be able to stay on topic. And sometimes that's hard, right? Because sometimes your patients get off topic. We have to learn how to bring them back, but we have to do it efficiently and effectively. We also need to think about basic skills for effective communication. So telephone etiquette. How many of you have called anywhere and this is what you get? And please, I'm going to apologize in advance for going so fast on this little scenario, but this is how we hear it. Thank you for calling ABC Health Center. Can you hold, please? Click. And first of all, I'm trying as a patient to register, what in the world did you even say? I don't even know, because you went so fast and you didn't even give me a chance. So how about, and I know you're hurried because you've got a million things going on. How about, thank you for calling ABC Health Center. This is Shelly. May I put you on a brief hold, please? And then wait for them to say yes. It makes a big difference, because even for me as a person, when I call somewhere and you go so fast, I just hang up and call right back, because I have no idea what you said anyway. So again, thinking about our telephone etiquette, understanding, of course, basic Word, Excel, understanding your EMR and all of the spots on there where you have to put stuff, understanding time management and organization skills. I am a big believer that at the front desk, you guys need a pre-visit plan. You know, we tell our MAs it's important to see who's coming in this week, pre-visit plan. You guys need to do that as well. Look at the schedule. What openings do I have for each provider? Who has a copay? Who has a deductible? Who has a past due balance? Who has a big no-show rate that we need to talk to them about, or a constantly late person? So again, just trying to be organized and manage your time. Go back to that pre-visit planning in advance. You have to be confident. If you sit with your shoulders up and ready for that patient to walk in, they look at you as confident and competent because you can speak and talk to them. However, if you are slouched down, your head's in the desk or the computer and the phone, you don't appear very confident. Be compassionate. You have to remember those patients don't feel good. That's why they're there, right? So when you don't feel good, you're not going to be the most friendly person. And when you think about it, we ask our patients, be on time, but our providers aren't always on time, right? So I get there on time and now you make me wait 30 minutes and I don't feel good. So if the front desk can help be compassionate and have empathy with that patient, you have to be able to collaborate with everybody in your health center in addition to the patient. So what does that mean for you? When you're doing that pre-visit planning and you see that somebody has a $300 balance, you should be collaborating with the billing office to see if somebody can get this patient on a, what do you call it? A payment plan. So we want to make sure we're collaborating with the billing office. We need to make sure to talk to our medical assistants and providers so we know, are they on time? Who's likely to no-show? Can I put a walk-in in? Can I double book you? So we're collaborating all day long. Speak clearly to the patient. And you don't have to talk so slow because that appears that we think they're not literate. So speaking slowly and clearly and articulate your words in lieu of, like I did earlier, thank you for calling ABC Health Center, and you can't even understand what I said. So slowing down. Think about if it were your grandparent. Every time you treat somebody, think about your mother or your grandparent. That makes you kind of take a step back. Make sure you know your financial policies, right? So if I walk in and you say, Shelly, it looks like you have a $5 copay, will you be paying cash, check, or credit card? And I go, well, nobody's ever asked me to pay before. Why are you asking me? Can you tell me why? It's really important that we know our policies. We have to know the what and why of everything we do. You have to know how to ask the right questions, how to resolve issues. So when you have a patient that's frustrated, how do you handle that? You have to keep a positive attitude all day long. So again, going back to that patient that's frustrated and yelling at you because they've been waiting on the doctor for 30 minutes, we can't get angry. We have to stay calm. So what do we do in our health center to diffuse that situation? Do we take them back to a room? What do we do? Those are things you have to figure out in your own health center. And you have to be positive and maintain a good relationship with that patient. So when they're angry, if you raise your voice and start talking like this, then that kind of fuels the fire. I always say when patients get angry, sometimes it's really good to talk super soft because it makes them stop and listen. So you have to be able to figure out how to work with your patients, right? So when your patient's banging their fist and yelling, if you get angry and frustrated, that's going to fuel the fire. But if you just talk really soft and say, Shelly, I am so sorry you feel that way. Can I talk to Dr. Jones and let me just see where he's at? Can I get you some water while I wait? I'll be right out to talk to you in just a few minutes. If you change your tone and your voice and lower it, it causes our patients to lower their voice. So this is a polling question I want you guys to answer. What percentage of face-to-face communication is for our words? What percentage of face-to-face communication is for our words? Give you just a few seconds to do that polling, and then we'll talk about it. Looks like about half of you have answered, so if you can keep answering. A few more seconds, if you can go ahead and just guess at what you think the answer might be to what percentage of face-to-face communication is for our words. Okay, so it looks like over 50% of you, over 50% of you said over 50%. About 6% of you said 43%, 13% said 27%, and 25% of you said 7%. So interesting, it is 7%. So let's see, let me get that out. There we go. So 7% is your words. 38% is the tone of your voice. So a minute ago, I talked about lowering your voice and talking a little more softly. And 55% is your body language. So really thinking about when you're sitting at that front desk, what does your body language look like? Are you slumped over? Do you have your hand on your head? So really thinking about your body language. Are your arms crossed? Things like that, patients pick up on that. Now, phone communication, they can't see our body language. So if I'm on the phone, right, I can have my feet up, I can be leaned back, I can have my head on my hand. 16% is our words, still very small, right? 84% is the tone of my voice. So really think about that. When you're face to face, patients are looking at your body language and listening to the tone of your voice. When you're on the phone, really think about the tone of your voice. That's what's driving the communication and their perception. So when we're thinking about communication, we really have three types: verbal, that's our voice and our tone. Nonverbal is our body language, and then written. So we need to think about, in your role, all three of those communication aspects, right? Because you have written communication, you have emails, things like that. Now, of course, there's always barriers to having really good communication. Physical barriers, right? Especially now with COVID, a couple of physical barriers, right? We have the glass. So even prior to COVID, a lot of you have glass. And when I walk in your health center to do an operations assessment, I don't feel very welcome. So how do our patients feel, right? It's kind of like I've got to slide the glass door open and I'm a little bit like, can I help you? So it's more like a barrier. I feel like an inconvenience to you. And talking about physical barriers with glass, if you think about another physical barrier just because of COVID, is our mask, right? Our mask is a huge barrier. So if you think about your mask, it's replacing your smile. And for people like me that talk fast anyway, can you imagine trying to do your job at the front desk and trying to communicate to people, and I've got this mask on and I'm trying to learn how to slow down my words? So we have a lot of barriers. Perceptual barriers. Charlie Brown, nobody likes me. Emotional barriers. So people think internally, like if they see two people talking, are they talking about me? Cultural differences, right? when communicating. Every culture has different barriers for communication. And then, of course, in your health centers as well, language barriers. So you really have to understand the barriers to have really good communication. One thing you really have to think about is when you are communicating, you have 30 seconds, 30 seconds to make a first impression. That's not very long. So the minute I walk in your health center, I'm already formulating my impression of this health center. So thinking about your patients, listening. God gave us 2 ears, right? And 1 mouth. If you think about the word listen, it also spells what? Silent. We're not good as humans at listening, right? So listen to our patients actively. I always say it's really important to like lean in. That way the patient knows I'm paying attention and I'm really listening. I like to say that we should be using I statements and not you statements. And this is hard. I struggle with this still to this day, even though I know it's the right thing to do, because use a trigger word, right? So if I see a patient's late, typically the things that we want to say are, Devin, it looks like your appointment was at 12:15. You're late for your appointment. And Devin's like, well, who are you to tell me that I'm late for my appointment? Versus if I say, oh, Devin, let me get you checked in. I see your appointment was at 12:15. It's about 12:24. But let me check with Dr. Jones and see how he's running. Ah, lets Devin know he was late, but it's not a trigger word, right? So really thinking about that, practice internally, even with your coworkers. Again, monitoring the tone of your voice when you get frustrated and upset and your voice changes. So just monitoring the tone. You have to be able to communicate appropriately with your patients about social determinants of health. So when you see the acronym SDOH, that's social determinants of health. And you have to be able to communicate without jeopardizing a relationship. So some of you have those forms where patients fill them out. And so maybe, for example, it might ask if they're a veteran or if they have, if they're homeless or have housing status issues. Well, sometimes that can be really offensive to a patient. So when that patient says, why do you need to know where I live if I'm homeless or if I'm a veteran? We have to be able to communicate with the patient why we need to know this. This is the why and the what that I keep talking about. So if you don't know, ask your team. Start doing some internal education. And this is really important when you're developing those initial relationships with your patients. So I'm a brand new patient. I'm going to look to see if I trust you. So building that trust, knowing the what and the why is so key. Compassion and empathy, right? So you have to be able to understand that patient. You have to understand how to share feelings with them. It doesn't mean that I'm asking you to have sympathy for them, but I want you to empathize with them. How to diffuse difficult situations. So this is what I talked about earlier. When that patient's there and they're yelling and they're banging their fist, well, we don't want to get all frustrated and stand up and yell back or raise our voice. We want to be able to diffuse that difficult situation. Practice that. Role play is key. People have real emotions, right? So it's okay to say, Mr. Smith, I am so sorry that you're upset. Do you mind if we go back? Let me get you in a room. Let me get you a glass of water and let me get my supervisor. Trying to diffuse. We don't want the whole waiting room in an uproar. I also want you aware. Remember, I said earlier, you have to own the reception area. So that means being alert and observant. Who's in the waiting room? How long have they been there? Do I know who they're waiting for? Has it been a long time? Do I know if they've checked in? It's okay if you don't know, just walk out there and say, I see you've been sitting here for a while. Can you remind me of your name and who you're waiting for? I want to check and see how they're doing. I can go back and look and see if they've checked in. I can check with the MA or the provider. Be respectful. Really think about the perception and patient engagement. So all of these things are tying together, right? So it's all about the patient and your work as the engager, if you will, the team builder. You have to know the different cultures. Earlier I said there's a barrier, language, cultural competence, things like that. So understanding those. And most important, understanding your patient's rights. What do they have a right to? So when I say be efficient, typically I don't read to you from a slide, but I like to read this because this is directly from dictionary.com. Efficient is performing or functioning in the best possible manner with the least waste of time and effort, having and using requisite knowledge, skill, and industry, competent and capable. So if you think about being efficient, you can assess your own efficiency right in your own health center. So for example, if I came in to do an operation review, if I sat with you and I saw that you had to get up and walk a little ways to make a copy or a scan and come back, I know you're not efficient. You should have all the things that you need at your desk. You should have a scanner, you should have the computer, you should have the copier right there, everything to be efficient. But before you can make your community health center efficient, you have to define the results you want. You have to know what your flow needs to look like. We know that highly efficient front desk staff members can reduce cycle time. What does that mean for your health center? Additional patient visits. What does additional patient visits do for your health center? Increase revenue, right? So if you think about efficiency, again, who does it start with? You guys, right? The more efficient you are, the more efficient my providers and MAs can be, which means I can see more patients, I can increase revenue in the health center. We can give more access to care. So we're trying to do maximum productivity with the minimum wasted effort. So these are things that you have to take back. You can't do them all overnight, but start trying to be organized. So if you think about it, if you walked into, for those of you that have kids, you walk into your kid's room and it is a tornado's gone through it, right? You're like, holy cow. Think about if your desk looks like that and I'm your patient and I walk up, if your desk is a hot mess, I don't think you're very organized. And then I'm starting to formulate my perception about this health center. So being organized, being proactive, this helps get better workflows, maximum productivity with the minimum wasted effort and expenses. So figure out your area. Are you the most efficient? You also need really good training. You have to know the what and the why and the best flow. So if you're missing things in the computer, ask billing to sit with you. What can I do to do a better job so we're not getting this kind of backflow in the billing office where you're needing information that I didn't get? Again, understanding the why, being accurate. These are all things that you can do in your own health center. How do I know if you're efficient? Number one, you have a really good physical space that's well designed and it's organized. You have really good continuity and coordination of care. So that's observing that waiting room, owning it, knowing who's there, knowing how long someone's been sitting there. You're accessible. So if I'm in the waiting room, you're accessible for me to ask a question. You're courteous. You know how to use technology. You're not up there trying to figure it out. You already know how to use it. So you're quick, you're efficient with that. And you understand the administration and the billing side of it. Again, this goes back to that what and why. So again, think about if you're not face to face and we're using the telephone, you have to be an active listener. You have to have really good manners and you're trying to multitask if you think about it because you're looking at the computer, you're on the phone. So you have to be good at both and you have to maintain confidentiality all at the same time. So when you think about telephone etiquette, who are you? Who are they calling? It's a verbal handshake, right? Thank you for calling ABC's Health Center. This is Shelley. How can I help you? So I've identified my health center and I've identified who they're speaking with and what can I do for them. So I'm friendly and I'm professional. I answer the phone promptly. If I do need to put you on hold, again, may I place you on a brief hold? And please wait for them to answer. Otherwise, don't bother asking. Again, you're identifying yourself, who you work for, and you're listening. And again, offer to help. Thank you for calling ABC Health Center. This is Shelley. How may I help you? And I always tell you, smile when you're on the phone. People can feel that. That's a little bit hard, I know, because we're thinking, well, they can't really see me, so it doesn't really matter what I'm doing. But I always say, even just buy a little like makeup mirror and set it on your computer so that you can see yourself smile, because it does make a huge difference. Again, we talked about asking permission. If I have to transfer you, so you want to talk to the nurse about a question you have, make sure to do what I call a warm transfer, not a cold one. A cold one is, hang on and I'll transfer you, and I forward it and you go to voicemail. In lieu of, if I say, Shelley, let me transfer you to Nurse Betty. Now, she may not be at her desk. If not, it will go to voicemail and you can leave a message. So I'm going to do the transfer. I'm going to wait to see if Nurse Betty answers. If Nurse Betty answers, I'm going to do that introduction. If not, I'm going to let the patient go to voicemail. Again, if you have to pick up another call, just again, excuse yourself from the conversation. And sometimes this is a really good way, if you have a patient that gets way off track and they're going through all of their life history that you shouldn't be knowing anyway. Sometimes a way to break that cadence is to say, Shelley, may I place you on a brief hold? I'm getting another call. Put them on hold for a few seconds, kind of regroup, come back, and then you can say, okay, Shelley, it looks like I have you scheduled Friday at 9 o'clock with Dr. Jones. When you come in, you'll need to bring a copy of your insurance. You'll also need to bring your copay as well as your medications or whatever your process is. But sometimes that's a really good way to break the cadence if a patient's kind of gone off kilter, to get them back on, is just to excuse yourself for a minute. So I am a big believer in creating scripts. You guys have so much, right? Remember all of the things you have to do. You can't remember everything verbatim. So really think about scripts. So if you're doing a scheduling appointment, what are they supposed to bring? Have a little script so that I can look at that script, I can pick it up and I can say, okay, I've scheduled you for your appointment. When you come in on Friday, here's what you need to bring. Your insurance card, your ID, your medications, your copay, whatever they need to bring. So just setting those scripts helps. Setting expectations. And then the back end of that is following through, right? So when you call to make your appointment, I say, Shelley, you need to bring in your $5 copay when you come. I check in at the front desk. What happens? Nobody asked me for my $5. So we don't follow through. So the next time I call and you go, Shelley, you need to bring your copay. And oh, by the way, you've got a $50 copay. I'm like, yeah, whatever, because I know you're not going to ask at the front desk. So we have to have really good follow through. Make sure that somebody is calling patients back. One of the things that I like to do is take one nurse and put them in the call center so that the call center staff can see the nurse and we can immediately transfer patients right to that nurse. I know if she's on the phone, so I can say, you know, Mrs. Smith, I'm going to transfer you to the nurse. She's on a call right now, but I'm going to have you leave a voicemail, or I can have you hold. It sounds like she's getting ready to get off. So I like to house a nurse in the call center. You also need to make sure you have plenty of staff to answer your phone, but you don't want to be staff heavy. So sometimes you just have somebody that's for backup when you have heavy volume, Monday morning, Friday afternoon, things like that. We have to be accountable. So what does that mean? Number one, you have to know your policies and procedures. You have to be responsible. If you make an error, admit it. It's okay. We are all human. But stand behind it and take responsibility. Know how to problem solve. Work with each other internally. Be honest and trustworthy. Your team demands it. Your patients demand it. Be dependable. What do I mean by that? If you're supposed to be at work at 8 o'clock, that is not 8:01. You're not dependable when you're not on time. If you're supposed to be at work at 8 o'clock, be there at 7:55. Come in professional. Have your hair combed. Be dressed professionally. Be ready to take on the day. Work as a team internally, both with your patients and with your providers, with your staff, everybody there. You guys are accomplishing a common goal. The front desk doesn't have any different goals than the back end. We're all after the same goal. Access to care, giving the best quality care to the right patient in the right time, at the right setting, for the right price. So teamwork, together we can achieve more, right? Being respectful, understanding other people's perspectives and ideas, making sure that we treat each other correctly. So if somebody has an idea that you don't think's good, we're not going to say, well, that's a stupid idea, right? We're going to be respectful. So again, just working together as a team. You have to remember you have external customers and internal customers. External customers are everybody that's not part of your health center. Your patients, people like me that maybe would come in and do consulting. If you have other business associates coming in, whether it's to take care of the copier, computers, internals, people that work in your internal organization. So the billing office, your administrative staff, your providers, your MAs. So you have both internal and external customers. And I always say too I find a little bit funny sometimes with our internal customers, we forget to be communicating correctly. So what happens sometimes I'll see is that maybe I'll call you and you'll be able to identify on your phone that I'm an internal customer and I'm calling you and you pick up the phone. Hey, yeah, what do you need? So again, that's not really great communication. So when we're sending the right message, verbal is our words. So face to face, 7%, we talked about this, of what people believe is based upon what they hear. Over the phone, it's still relatively low. 13% of people believe what they hear. Vocal, that's your tone of voice. So when your tone is really loud and sharp or soft and spoken, 38% face to face of what people believe is how your words are spoken. 86% when I'm on the phone. Visual, so again, your appearance, your look, 55% of people believe is based upon what they see in another person. Obviously, the phone is relatively low. The stats show 1%. I don't even know how it really can be 1% because they can't see you. But you can see we're really focused on visual and vocal. So with your verbal messages, watch using medical terms. We tend to use medical terms or jargon. Sometimes patients don't know what that means, right? Explain to the patients. Watch their facial expression. If I look confused, ask the patient, does that make sense? You guys have to be able to really read people because not everybody has the same literacy level, which you already know that. So it's your job to know, do I have to talk up or talk down a little bit? And I don't mean talk down to the patient. I mean changing your words so that it's something that they understand. Sometimes you have to clarify, change how you say it when they look confused. Also, give them a chance to reply or answer or talk. Listen is the same as silent. Say thank you. It's okay to say, I'm sorry. I'm sorry you're frustrated. I know you've been waiting a long time. Thank you for being a patient of ours. These are all things that we want to start telling our patients. Thank you for being a patient. I'm sorry you had to wait so long. So, mood altering language. Think about the things that alter patients' moods. I come in and I don't feel good and I'm grumpy and I had a hard time getting there. Shelley, we're delighted to have you today. Oh, they're delighted to have me? Now I start changing, right? It's been our pleasure to take care of you. We're happy to see you. All of these mood altering languages change. You might be the only person to thank the patient that day. You might be the only person to make that patient smile today. So think about mood altering language. Vocal cues. What does that mean? It's your rate, your rhythm, your pitch, all of those things. Have you ever sat across from someone and you're talking to them and they're like, well, that shows I'm not very interested in anything you have to say. So when we're thinking about how we talk, our qualifiers, our characteristics, that starts to show a patient or our team members if we're competent, if we're trustworthy, if we're engaged. So sometimes I have kids, so I can use them as a prime example. Is when I'm talking to them, if they have their cell phone and they're texting, I just want to turn around and just knock them to kingdom come because it shows that they're not engaged in anything that I have to say. So sometimes you can't do this with your patients, but you can do it with your team members. If you feel like they're ignoring you and they're not engaged, sometimes either along the way, I might just say the cow jumped over the moon and then I might keep talking to see if they realize what I just said. The cow jumped over the moon. Really, where did that come from? Or sometimes I'll just stop in the middle of my sentence to see if they even notice. So visual appearance, that's more than just coming in clean and dressed and appropriate, making good eye contact, being in control of your facial expressions, right? So don't roll your eyes. Make sure you nod when you're listening to show that you're engaged. That's acknowledging that person talking to you. Make sure your name is visible on your badge. If you have a uniform, come in your uniform. Don't be on your cell phone. When you're taking care of me as a patient, be engaged in me. So, some interesting facts. For every patient who complains, there are 20 that don't. Think about that. For every patient who complains, there are 20 that don't. So those other 20 are not going to complain to you, but they're going to tell everybody they know. Of those who are dissatisfied, only 10% will return. 90% will not. 10%. It takes 10 years to change a poor customer service image. 10 years. So think about this. Think about if you got on and you Googled your health center and looked at the reviews. What do they say? Now, I will tell you, we have to take those reviews a little bit with a grain of salt because sometimes there are people, as you know, that are going to complain about everything. But it's that patient's perception, and their perception is reality for them. So looking at those reviews to see are there things that you can do in your role to help change those reviews? So if they say that the front desk isn't friendly, can you change one thing to start changing their perception. Okay, so how many positive experiences does it take to make up for just one negative? So if I'm a patient and I've had a negative experience, how many positive experiences does it take to make up for that negative one I had? We'll give you just a few minutes. Give you just a couple of more minutes. All right, so it looks like 36% of you said 5 and 36% of you said 12. 21% said 9 and 7% said 3. So, of course, the actual answer is 12. It takes 12 positive experiences to make up for one negative. So that's a lot. So if you think about, if I come into your health center and have a really bad experience, if I decide to come back, it's going to take 12 good experiences for me to forget about that positive experience. That's a lot. So we're in a different world right now, as you know, with COVID. So sometimes it's really hard because you have your mask on, right? So as a patient, I'm not seeing that friendly smile that I want to see. So how do we overcome that, right? We've got to start thinking about different avenues. So using your words. So trying to use those mood altering language. Oh, Shelley, it's a pleasure to have you today. Looks like you're here for Dr. Jones and your appointment's at 10. Everything's up to date. Now it does show you have a $5 copay. Will you be paying with check, cash, or credit card? So it's a pleasure to have you. So I'm changing that. Again, the tone of my voice, thinking about changing that tone. Do I go up? Do I go down? Also using your hands. I'm a talker. If you've ever seen me in public speaking face to face, I use my hands all the time, probably more than I should. But your face is more than just your mouth. So even under your mask, when you're smiling, your cheekbones go up, your eyes change. Even like I said earlier, lean in and listen. All of these things help change because we do have that mask on, which is a little bit hard, but we don't want our mask to scare our customers. So we just have to challenge ourselves to come up with different avenues. So leaning in, smiling anyway, because I know my cheekbones are going to go up, using my hands as I'm talking to them, actively listening, meaning silent. These are all things I can do. So what I want to do is challenge all of you. Take one thing to work on between now and next Friday, when we have our second webinar, to see if you can change yourself to offer a better customer service experience for your patients. Now, this does not mean that you can't do more than one thing, but I want to challenge you all to at least do one. So now I'm going to open it up for questions or comments or things that you're doing that are working really well, or things that you're doing that you need some assistance with that you're like, this isn't really working so great for us. Does anybody have other ideas? Because we can all learn from each other. So you can either put your question in the chat box and Devin can read that to me, or sometimes it's just easier to go off mute and ask your question or give your scenario, and then you can go back on mute. So Devin, do we have any items in the chat box?
I do not see anything currently.
Okay, perfect. So try to think about, in your own health center, just try to think about your role. As I said earlier, you guys wear a lot of hats. So take one hat and perfect that hat. right? Because you can't eat an elephant in one bite. So think about if you say, gosh, I'm not great on the telephone. Telephone's really not my thing. I talk really fast. I'm not super friendly or engaged. If that's an area, then think about, what am I going to do? So the one thing I'm going to work on the telephone is I'm going to slow down. I'm going to use some mood altering language to thank that patient for calling. And I'm going to make sure I don't put anyone on hold until they say it's okay. That's an easy thing to work on. So just pick one thing. We don't have to take everything and say, golly gee, I'm going to do all of these things, because it's hard to do everything. You're already busy. So just take one thing. If you're really good on the phone, maybe say, I'm going to work on pre-visit planning. I'm going to try to be more organized at my desk. I'm going to challenge my coworkers to pre-visit plan so we're all organized. All right, so does anybody have questions or like a scenario or something you guys are doing really well you want to share with everybody that maybe somebody else can learn from? Because we're really quiet today. Everybody's like, we're hungry. It's Friday. It's almost the weekend. It's the first of the year, so it's crazy at that. All right, no questions, no scenarios. Anybody? Remember, if you have a question, somebody else is wanting to know the answer to that question also. They're just sitting there waiting for someone else to ask. Anybody?
I'll go ahead and ask one. My name is Jenna Green. I work at HealthWorks in Cheyenne. And I have our front office supervisor joining me today, but I first want to say this couldn't be any more timely. So thank you
Perfect.
for this. Tension is high between patients, staff. There's just a lot going on.
Yep.
I think just a broad question for you is
Yeah.
as we look to roll this out with our front office and just get them more mindful of some of these topics, do you find it more beneficial to work with folks individually or start first as a team? Because we're just trying to brainstorm how to communicate all of these topics.
Yep,
And
absolutely.
and
I can tell you some recommendations. I recommend you roll it out as a team. I'll tell you, I just did actually for Zoom webinar for Montana. In fact, we did communication for the entire health center. So they shut down for 2 hours and it included everybody from the top to the bottom. So I would tell you to roll it out as a team at your front desk. I would also ask your front desk to even kind of do like maybe give them a piece of paper or send it to them. They can type it and print it out. So because some people wanted it anonymous, on things that they think the front desk does really well. Give me 3 things you think the front desk does really well and 3 things that we need to work on at the front desk. Ask them to type it out, print it. If they don't want their name on it, they can just fold it up and put it in a box. So then as you're building your education, you can kind of see from the people with the boots on the ground what they think we do really well and what things we need to work on. It's amazing when I do staff surveys how many people are so honest on their surveys if they think that they're not going to be penalized for it.
oh, that's fantastic. Okay.
Anybody else? That was a great question. Well, between now and next Friday, if you think of anything, you can always get it over to Devin and he can get it to me and then I can make sure to address it before we start the next one on Friday. So I know
So
sometimes, yeah.
we do had one
Oh, yeah.
tech come up.
Perfect.
So Jamie says, in my organization, Community Health Centers in Riverton, we work in a satellite clinic. We struggle to build relationships with our patients because of many new faces. Of the many new faces they can see. Can I get some ideas of how to integrate new staff and keep that safe and friendly place for our patients?
How they can integrate, sorry, you were cutting out, integrate staff and what?
How to integrate new staff and keep this safe and friendly place for our patients.
Sure. So if your patients are coming in, this again, where I would say goes back to pre-visit planning a little bit, because if I'm already knowing who's coming in, and then if I'm brand new, I would tell you to have your brand new staff always sit with somebody that has been there and has the experience, and challenge that new staff member. So I'll just pick on Devin. If I were the staff member and I was new and he was a patient and I don't know him, when he walks in and I go to check him in, and I ask him for his name and I get all that information. And then I might say, Devin, it's so nice to meet you. I'm Shelly and I'm new here. So can you tell me something about you to help me remember you next time when you come in? And then let that patient give me an idea of, I've lived here 25 years or, something like that. But letting our patients know, this is my name and I'm new here. Can you tell me something about you that will help me remember you next time? If there's a spot in your notes on your EMR, I always tell staff members that's a great place to write things. A lot of times providers do that so that they remember patients. So they'll put in, Shelly was going on vacation to, Florida or wherever, so that when the patient comes back, the provider doesn't typically remember all of those patients, but they look at those notes and say, oh, how was your trip to Florida? Last time you were here, you said you were going. And the patient's like, oh, they remembered me. They actually just looked at the previous note, right? So anything that your new staff members can do to get to know that patient.
Awesome. We also had another one come in from Betty. She says, we see many patients a day along with the phone constantly ringing. What would be the best way to prioritize all of the tasks and information received so every patient gets the best care?
Yes, that is a hard one. So I would tell you to kind of do a call study, and this again would come to your upper management, because if you are getting so many phone calls that it's taking away from that face-to-face interaction, then it might be time to have dedicated phone staff. So I have a lot of health centers that are starting to move where they have what I call a call center and front desk being separate, even though they're all part of the business service team. So doing a study to say, how many calls are we getting? Other things that some of the health centers that I work with do is when they are realizing that it's a really busy time for calls, if they only have the front desk that are doing both and they're multitasking, is that I might say to my colleague, okay, why don't you answer the phones for the next hour? I'll check everybody in and then we can swap. So you just have to learn internally, when is my high volume for calls? And maybe at that time, I just dedicate a staff member only to do phone calls while the other staff member or members are doing check-in face-to-face. Other questions?
I'm not seeing any pop up at the moment, but we are at 12 o'clock on the
Okay,
dot. So
perfect.
if you are ready to let these wonderful attendees go, then we can go ahead and disperse. And then the recording will be available here shortly. Once that is available, I will send that out to everyone.
So again, thank you guys all for joining today. And in the interim, if you have a question between now and next Friday and you think about it, you can always email that over to Devin. He can get it to me and then I can just answer those before we start next Friday. Otherwise, we will see you all next Friday. Have a great weekend.
Thank you, everyone. And please fill out the survey when you have time. Have a great weekend.
Bye, everybody.